Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Well, today we're talking about you are more than just your spine. Did you know that?
That's what we're talking about? Well, I did know that we are more than just our spine.
Uh-huh.
But the spine is very important, though.
It's very important.
Yes.
You need it for the rest of you, right?
You do. It's
something to put the head on. And
right. Keep everything attached.
So what do you mean, Dr. Prather, you are more than just your spine?
Well, as a chiropractor, there's a huge emphasis on the spine. But, but I don't want people just to think of chiropractic as just dealing with the spine. Mm-hmm. Because we do so much more, and many of our patients, that come in here don't have anything wrong with their spine per se, but need some other different types of chiropractic care. So one of the things that we let people know is that we provide care for the entire body.
Mm-hmm. Okay. So not just the spine. Why is there such an emphasis on the spine then?
Well, that's the basics of the chiropractic philosophy. Mm-hmm. The chiropractic philosophy is that the spine, with the central nervous system being involved with that, surrounded by it, mm-hmm. is one of the major keys to someone's health, which I completely agree with. So as we are looking at the spine, the chiropractic philosophy is all about that. There is a huge emphasis on that, and the philosophy of chiropractic is that as you can get the spine aligned, it opens up the nervous system, and the nervous system is the channels that tells the body how to heal itself. Okay.
So why are the extremities important? That's kind of what we're going to be talking about.
Yeah, it's but there are a tremendous amount of involvement with the rest of the body. Mm-hmm. And many of the patients that are coming in, that have had injuries to their spine, also have other different types of injuries that are involved in other areas. Their wrists, their elbows, their shoulders, their knees, their feet. And if you don't get some of those things fixed, not only is that a problem, but it can also affect the spine. In other words, you may not be able to get the spine completely stabilized if you don't get the rest of the body fixed.
And it might not be an injury per se, right? It could be overuse.
Could be overuse, yeah.
People at the computer. We
Sure.
see a lot of people when they think it's carpal tunnel, and we're going to talk about this,
right.
Which you find a lot of times is misdiagnosed. So it's maybe not be an injury per se, but an issue with overuse.
Even stress. Mm-hmm. Just going through the day. Mm-hmm. Doing computer work. All those different types of things. Difficult positions. Somebody cut you off, in traffic, mm-hmm. and you clench your jaw real tight. You're in stressful types of situations. That can all play a very big role, and those can show up in your body. Mm-hmm. Those types of things can throw things off. If your feet are having difficulties and aren't aligned correctly, that's going to affect the pelvis. Mm-hmm. The pelvis is going to affect the low back. The low back is going to affect the neck.
Isn't there a song?
Yeah, everything's kind of connected
Don't worry,
to
I'm
each
not
thing.
going to sing it.
Oh, okay, good. But there's an awful lot of involvement on that, and the chiropractic philosophy is excellent. There's a huge emphasis on the spine within chiropractic. That's where our major training is. But there is more to the body than just the spine.
And that's the title of the show. You are more than just your spine, right? Well, what percentage of patients do you see, Dr. Prather, that you're adjusting extremities?
Well, if we have them over for adjustments, which isn't all of our patients, mm-hmm. Not everyone has difficulties along those lines. But of those adjustments, those people that we need to adjust over there, it's about 95%. that we also need to adjust an extremity. Because as you have that connectivity throughout the body, then there are different types of changes that will occur. So as you are working with that is something that shows up on a regular basis.
Didn't we have a patient that was just coming to get their feet adjusted and didn't realize
then I actually
adjusted the spine?
It was pretty funny. He had been referred in because I had solved a friend of his feet.
Yeah.
And he knew someone else. He actually knew two people that I had fixed their feet. And he came in, and we checked him out. We actually checked his spine to see if there was an involvement. There wasn't. It was just in the feet and the ankles, and we adjusted that and had done very, very well. He was extremely pleased. He happened to see me adjust someone's low back, and he says, "Oh, my mom's got low back problems. Do you adjust low backs too?" Which is
not really funny. It means we're not really doing a good job of educating people.
But it is just kind of show people, that there's trying to get people educated on all the different types of things that we do is so important. That's one of the reasons that we have this radio show, is educational purposes. But so his mom came in, and we fixed up her low back too.
Well, do all chiropractors adjust extremities?
No. Matter of fact, we have several patients who came in, who have been to chiropractors before. And I sit there and I says, "Well, it appears that you have a knee problem." And they said, "Yeah, but, I said, has your chiropractor ever addressed that?" And they said no. And not all chiropractors, philosophically even believe in going elsewhere.
Okay. Meaning adjusting
extremities.
Okay.
Yeah, that there's philosophically a feeling of just staying with the spine and with the basis of chiropractic. But my philosophy is whatever the patient needs. It's much more of a patient oriented type of an emphasis, and so
heal the patient.
So many of the I've had many patients who've moved elsewhere, went to other chiropractors, and they called up and they said, "I can't find a chiropractor to adjust my ankle like you did, or my elbow, or my jaw. What do I do? I've called around and they're not quite sure what to do." So it's not something that is necessarily always done by a chiropractor.
Did they teach you extremity adjustment in school?
They did not.
Okay.
That was not part of the standard course, at least in the chiropractic college that I went to, was actually adjusting. It was a very strong philosophical school where they emphasized just adjusting the spine. But that is something that I found while I was in school that was necessary.
So where did you get your training?
Well, there are
adjusting the extremities.
Certainly, there are many of the schools, and I think now in the school they do actually teach extremity adjusting.
Yeah, because you went way.
Oh well, let's not get a little personal here, okay?
It's true, right?
It has been a few years, just a couple decades, 3 decades.
To be specific, right?
To be specific. But it is something that they have a whole courses on how to do that. One of the interesting things was that, like the foot adjusting. There was a book in the library on chiropractic adjusting. And podiatrists used to be adjusters of the feet. They called them chiropractors. In 1959, they decided to become more medical, and so they dropped the adjusting and went more to surgery and
interesting. In 1959.
1959,
not that long ago.
They found that they really needed to switch over. So I got into that from reading a book. Now they have whole courses on foot adjusting now, but that was something that chiropractors.
Just in your easy reading. going to the library.
In my reading, as I was kind of perusing things, I sat down and read that book that night. Next day, I was starting to adjust the feet, but nobody at that time really did.
Interesting.
None of the chiropractors did. So that was just one of the different types of things. But there is a whole course.
The feet are so important. I mean, if you don't have healthy feet, aligned feet, it's really hard to do anything.
It's very difficult to get the the knees, pelvis, low back, even the neck stabilized.
Because I know you have to adjust my feet. I have an old track injury.
Yes.
That comes up every once in a while.
It does.
Usually when I start running again. And there are a lot of bones in the feet. So
there are a lot of bones in the feet.
You got to keep them aligned.
That's right.
Now, how important do you consider extremity adjustment?
Extremely. For the health of the patient, to really get things stabilized, to get people 100%, the extremity adjusting is extremely, extremely important. There are many times I just can't get someone well unless I get their extremities adjusted. And a matter of fact, I get a lot of patients who come in who haven't found satisfaction, elsewhere. I've had people who came in, well, I've been to 4 chiropractors, and, I haven't been able to get this problem resolved. We do an exam on them, and I say, well, your jaw is misaligned.
We had a chiropractor shadowing you yesterday,
Sure.
and saw that you do have to adjust the jaw quite a bit.
I do. And I said, well, you're not going to get these headaches under control until that jaw is also fixed.
You have a disc there, right, in that joint?
You do. That
just
slides
like
back
the
and
spine.
forth. Right.
Yeah. Interesting.
So, very, very important.
Well, when we come back, let's talk more specifically on specific extremities that we're talking about. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, there was a major study by an insurance company that focused on the healthcare model you use in your office. What were the results of that study?
It actually was quite a seismic finding. I like that term.
Yeah.
Blue Cross Blue Shield of Illinois. It's a Chicago-based health maintenance organization. The group has 600,000 enrolled members. So they took about 10,000 of those and put them in with chiropractors who are trained in the structure-function model. Now, not all chiropractors are trained in the structure-function model. These gentlemen actually got the same type of training that I had. And they were the primary care physicians. After 5 years, they had startling results. They had a reduction of 60.2% in hospital admissions.
Wow.
They had 59% reduction in hospital days. They had a 62% reduction in outpatient surgeries and procedures, and a remarkable 85% reduction in pharmaceutical costs.
Wow.
This resulted in a total savings in the first 5 years of 40% over all the other primary care physicians.
40%.
40% reduction. If you can imagine that we could reduce our healthcare costs across the board by 40%.
And get those kind of results.
And there were 80% less reactions. There was a reduction in lawsuits. There was a reduction in everything. Plus, the people were much, much healthier and much more satisfied. The interesting thing is that the specialists, the cardiologist, the oncologist, the gastroenterologist, all the specialists, as they were asked to rate the difference in the two different models, they gave the structure-function model as the primary care coming in, a 96% satisfaction rating, and they gave the disease model as primary care a 40%. The results are indisputable.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
And I'm feeling good.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. Today we're talking about you are more than just your spine. I don't know why I want to go into song when I hear that. There's a song about you are more than the mistakes you've made. But I will not sing. So
You keep threatening us. No, you have a beautiful voice.
Oh, thanks. Well, let's talk about what are we talking about in extremities. It always makes me laugh because I had a patient send me, it was actually a T-shirt of a person and their skeleton grabbing another person's spine and saying, "I got your back." It's hilarious.
That is a good one.
So is it everything else that's left?
Everything else that's left.
Okay, so everybody's got that visual now.
Right. So you've got the spine, and then anything that's not the spine is considered an extremity adjustment.
Okay, so we're talking about jaw, shoulders, wrists, knees, feet, and we're going to get in that specifically.
Yep.
Okay. Is there insurance coverage for extremity adjustment?
Yes, there is actually a CPT code for extremity adjustment. That is covered by most insurances, so that is a reimbursable type of adjustment. So it is an acknowledged type of portion of chiropractic.
Okay. So let's talk first. How about the jaw? You said you have an interesting story of how you got into adjusting the jaw. And for listeners that maybe be listening for the first time, you've been practicing how many years, Dr. Prather?
I've been practicing over 30 years.
30 years. And you still are the one you're adjusting people.
I am.
And so you've learned some things on the way.
I have learned a couple of things, yes. Yes, it's been quite an interesting journey. Very enjoyable. I love doing it. I love working on people's bodies, which is great. But as I was going through school, I had a friend of mine who had actually tried to commit suicide 3 times because of the terrible jaw problems he had. It was pretty much unbearable. What he was going through. And he was a good Christian guy. I mean, he had a lot to live for. He was intelligent, great guy, good personality. He just said that, he got into a point of desperation and any type of escape that he could possibly have. And he had been all over the world trying to get that fixed. And, he knew that I was a chiropractor. He had heard that I was a chiropractic student at the time. I wasn't even a chiropractor. But I had solved several people's problems that we both knew. And he said, what can you do for me? And I said, well, I don't know anything about the jaw. And I tested it and could tell, that, there was an incredible amount of spasm. I'd been trained very well in how to evaluate a joint, and took a look at his jaw, and I said, well, let me do a little research. So I started to do some studies on that. Did you read again? Yes. I read a couple books on it.
That's kind of a joke because all you don't get to spend your money much, but when you do, it's on books.
It's on books. Yes. That's kind of my thing. And I sat down and found several different types of articles, books, things along those lines, studied the mechanisms of the jaw, how it worked. And I had actually asked professors and different very well-known chiropractors at that time, and nobody was adjusting the jaw. So I couldn't really find anybody who was working along those lines. So I came up with some different techniques and was able to get him completely out of pain.
Wow.
It took a little while, some work along those lines, and I kept, as I was working with him, I says, no, I'm still trying to find someone, to help you with this, who's, what I would consider an expert. But, I said, I still don't feel qualified. And he says, he said, I'm not going to anybody else because everybody else makes me worse. So he said, just to let you know, I can actually live with this now.
Wow.
At that point,
Yeah, because that can be very painful, right?
Oh, it's probably one of the most painful types of misalignments that can possibly be out there.
Why is that?
The jaw not only has an effect on the pain centers just because of the innervation. It's the disc that's inside there is the only disc that has a muscle attached to it.
Oh, wow.
Directly.
I never thought about that.
And then it has a nerve that goes right from that joint directly into the brain to the emotional center.
Okay. That's not a trigeminal.
No,
okay.
It's a branch off of there. But
okay.
it goes directly into the brain.
Okay.
And it has a direct not only effect on the pain centers, which is excruciating, but it has a direct effect on the emotional centers. Because the jaws, if you get emotionally stressed, the jaw will tighten up, but if the jaw tightens up, you can become emotionally stressed. So there's a very strong, not only was he in pain physically, but also emotionally because of the jaw misalignment. So, it was even more of a devastating type of a problem. And we can get some really, probably our most bizarre types of symptoms comes from the jaw.
Wow. And you can find pain all the way down to the ankle coming from TMJ, right?
Yes, there's the jaw is one of the centers that tells you kinesthetically where you should be. So it has to do with the whole alignment of the entire body.
Wow.
So the pelvis will shift as one of the major things. We can
From
get some knee
TMJ.
problems from TMJ.
Wow.
Very, very important to make sure that's fixed. And one of the missing things, not a lot of chiropractors or either physical therapists or other different people know how to really work with the jaw physically. We can get some very, very immediate type of relief with the jaw adjustment. We've gotten it down at this point. Matter of fact, my whole system of adjusting the jaw is completely self-taught, and it's my own system. I have taught that.
We got to name it.
Yeah, that's true. I have taught that to other chiropractors who found it extremely effective. But trying to work with that was a very interesting type of a case, and it really taught me a lot to kind of go out on my own and develop some different types of techniques.
Yeah, and when you think of the TMJ joint, okay, that has a disc there. It's used.
And the disc doesn't just stay still like the other discs.
Yeah.
It slides back and forth, has a direct muscle attachment to it.
Yeah.
And it's
used
very
constantly through.
Well,
we talk,
more
we chew.
More in some people than others.
I know when I say that, because I teach resistance exercises for the jaw. So we do show people, because it's usually a hypermobility, correct. in the joint. And there's muscles, like you say, that attach to it, that go into spasm, and people might be clenching their teeth at night, and so it's really important to teach people those exercises too.
It's very, very important. It's a whole process on getting that fixed, but we are pretty much 100% successful in getting those TMJs fixed, and that's a very, very difficult and a lot of TMJ specialists is extremely expensive, and ours is much more reasonable and actually much more effective.
So anything else more on the jaw before we go to another area?
We've done a whole segment on the jaw.
I know, we've done a whole show on the
yes,
jaw.
it's a, so it's an ongoing type of thing, very, very important, but there is hope for that.
Now, sometimes, too, I think people think it's their neck when it really is their jaw, because it does tighten a lot of the neck muscles.
Whenever you need to distinguish between the two, between whether it's of cervical origination on the neck pain or from the jaw, because it's completely different. The jaw, when it's out of place, it's all the upper motor neuron innervated muscles, the sternocleidomastoid muscle, anterior scalene, levator scapular, that go into spasm. Whereas if it is from the cervical spine, it's the other muscles. It's the lower motor innervated. So, being able to diagnose that, look at that, see exactly what's going on. And oftentimes, of course, one of the things is you have to get the atlas and the skull set before you can get the jaw fixed.
Right.
So, it's an involved type of process, and it can be difficult, if you're not well trained in that, to differentiate between the two and then get them both fixed.
Right. And I think that the posture and alignment of the neck, like you said, is very important for the jaw.
Yeah, you really, really can't. I've read several articles confirming that, and I found it very true in our practice, that atlas and occiput has to be set first before the jaw will respond correctly. Okay.
When we come back, let's go on and talk more about other extremities, shoulder, joint, elbows, wrist. We got a lot more to talk about.
All right, sounds great.
Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
I think I'm lactose intolerant, though, because last night I had 4 milkshakes and I felt like crap. I think it's the lactose. If you are lactose intolerant, don't be ashamed just because your tummy can't handle that spicy milk. Do you have anything milder than milk? But not water, that gives me gas. Yeah. Try and lay off dairy. I bought some of that Country Crock margarine. Didn't stick in the fridge right away. It turned into gasoline. That's got to be a tough product to market, because not only is it a bucket of whipped grease, someone had the audacity to call it crock. You think this is butter? It's crock.
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at The Voice of Health. We're talking today about you are more than just your spine. We just got done talking about the jaw, which you adjust quite a few people during the day. Their TMJ, their jaw.
Oh, very common stress, and then computers.
A lot of desk work.
Right. When you're constantly in a flexion position, that puts more stress in the jaw.
Yeah.
One of the big things is getting people back into extension. It really takes a lot of pressure off of it.
Yeah, and that's what we do in our rehab portion, is really work on posture.
Sure.
So many people have those rounded shoulders, and it just causes...
Well, it's a society type of thing, with the advent of, especially with the computers, it's a constant type of positioning. So, I have my people who come in for their monthly adjustment, and usually it's always with her jaw, and it's just like, yeah, it's been really, really rough. I had to spend 12 hours yesterday on the computer. Mm-hmm. So it's
people are just, they're working so hard. I just had to say that. I mean, we have some patients, they're doing conference calls, right, during their treatment. It's like, people just can't get away from.
I know. Our work follows us now.
Our work follows us, yeah. Not yours, though, right? No one's following you home.
Well.
Or are you talking about you have to work on me? There we go. Yeah, that's true. But you want me around for a long time, right?
I do.
Okay, good. So let's talk about other extremities. Do you adjust the shoulder joint? What do you do for the shoulder?
Absolutely. The shoulder, you're talking about quite a large mechanism. You've got the clavicle, collarbone. Mm-hmm. You actually have the shoulder and shoulder joint itself. You have the shoulder blade. Mm-hmm. So, there's an awful lot involved with that. And anytime anybody has either TMJ or some cervical problems, the shoulder's usually going to be involved.
Why is that?
Well, there is if the neck and the head aren't functioning properly, it's going to throw off the shoulder. Mm-hmm. There's going to be some tension. There's going to be some abnormal motion. The innervation of the nerves going down into the shoulder. You have the levator scapula, which, if it goes into tension, is going to actually pull the shoulder blade out of position, which is going to change the whole mechanisms of the shoulder. Mm-hmm. So I've had a lot of people with shoulder problems that first needed their neck and their jaw fixed before the shoulder would actually respond.
Interesting. So then you have a lot of nerves that go through.
Yeah, you have the whole brachial plexus that goes through there. The shoulder joint itself usually has a positioning where it goes forward and then down out of socket. Mm-hmm. So 90% of the actual shoulder joint itself is the same type of adjustment. There are abnormals on that, but it's a pretty standard type of adjustment along those lines. But also getting the whole shoulder, the scapula, released. You got the whole rotator cuffs. And, even people who have to have surgeries, eventually for the rotator cuff, do much better if we adjust it prior.
Right.
Because then at that point we can get much, much better results, from the surgery itself.
Can you help in preventing surgery?
Yes, many people have come in to us and said, I got I've got shoulder surgery scheduled out, in 8 weeks, but it's real painful right now. Is there anything that you can do? I've tried the physical therapy, it helped, but they said, there's nothing more we can do until you get your surgery. Mm-hmm. So we go ahead and start the adjusting process, get that settled. Once I get the adjustments, then we can actually work with the muscles, get things down, do some acupuncture to get the inflammation out. Mm-hmm. And
corrective exercises, huge amount of that, getting things stretched out, strengthened. And by the time their shoulder surgery is ready to occur, they go back into their orthopod who's going to do the surgery, and they said, there doesn't seem to be a problem. It's not enough of a problem to justify the surgery at this point. Right.
So, it's not all the time, but I would probably say it's almost 90% of the time.
Yeah, I was kind of encouraged. We had a patient who fell down the stairs, a young gal, and it was on the weekend. She went to ER, and then she came right into us we got her in on Monday morning.
Yeah.
But in ER, they had a physical therapist come and help with the alignment and start her on some good exercise program, corrective exercise that really helped.
She was real nervous because she's
used to you.
Right. Yeah. She's used to and she said, no, I'm real nervous, because she says, what I'm going to do is adjust your pelvis a little bit. Uh-huh. And she says, ooh, I've had bad adjustments, people working on me before. I really like the guy I go to, maybe I should just wait. And she said, well, let me just give it a try. She was very gentle, moved it properly, and she could feel a definite release.
Yeah.
So,
that was in ER. That's
ER.
where that needs to be.
You're right.
I mean,
this type of
we need
work
to have
needs
chiropractors in ER.
Yeah. Chiropractors, physical therapists, people who are thinking about getting the alignment right, because none of the function, the pain, all those things, if the skeletal structure, it just makes sense.
Yeah.
The skeletal structure is not in position, nothing's going to work right.
Right.
And you're going to
it's like
have
a building.
some stress. Right.
Yeah.
You're going to have pain, you're going to have inflammation, you're going to have discomfort. So, looking at the alignment is very critical. And quite frankly, the physical therapist did a great job with the adjustment.
I know we had a gentleman who had frozen shoulder for years. He couldn't get his shoulder above 90 degrees, and he had started babying it and really not using it.
Yeah, and there was even loss of muscles.
Yeah, right. Some atrophy of his muscles. Came in, and he was seeing you for other things too, but you started adjusting. We started in the rehab part really challenging that shoulder joint, and now he has functional range of motion, which
it's fantastic.
Yeah.
And that's going to save him so many problems as he goes along.
Right.
Really decreases aging. It has an effect on the lungs, the heart, all those types of things.
So anything more you want to say about shoulder before we go on to the elbow?
We could do a whole show on the shoulder.
Shoulders connected.
We're going to run out of time.
Okay. Let's talk about the elbow. I think the elbow is very interesting. I'm an occupational therapist. And, talk about the elbow and what you find there a lot of times, especially with people that work desk jobs.
Yeah, the elbow is a huge problem. Of course, people who play tennis, that's very important for them. Desk work creates a tremendous amount of issues in through the elbow. And of course, as you're looking at that, you've got quite an interesting structure in there. You have the two bones that are coming up in the forearm, and then there's actually a twisting motion that goes along in there.
Yeah.
And so there's a lot of opportunity for injury on that. It's a very easy type of thing to get out of place. And then the nerves go right across there. You've got the radial, median, and ulnar nerve. And if you get certain muscles that go into spasm because of misalignment, that can really, really hurt. So
are you finding you're having to align the radius and the ulna?
Yes, we find a lot of alignment issues that need to be taken care of. It's actually one of the easier joints to adjust, and once you adjust it, it's one of the better ones that actually stays in place. The jaw is just like, got to train this thing because it's difficult. But the elbows respond very, very easily and quickly. People are always surprised. I've come in, I've had this tennis elbow for years, and I've tried everything. They've tried the steroid shots. It works for a little while. I've tried the physical therapy. And I go in there and I adjust it, and they go, "How long is this going to last? This feels great." And most of the time, it actually lasts on at the most, usually 3 adjustments.
Yeah. Then we show them some nice stretches.
And then, you see, and that's what works so well is, the physical therapy that they did is the same thing that you do. Do you know what I mean? But they didn't align it first. If you don't align it, even you exercise it, you just...
you make my job so easy.
Well, and we've had other physical therapists in here before.
Yes.
And they say, wow, it just, this really works great.
Right.
Once
then you can really focus.
Right, then you can really focus on the
muscle,
soft tissue, and the soft tissue responds fantastic. So the alignment is just such a key part.
So a lot of times, and you talk about the palmaris longus muscle, correct?
Correct.
That's the muscle. So are people thinking it's carpal tunnel when really it's a palmaris longus issue? Or
I would probably say, I've had people who went through carpal tunnel surgery. With no changes. And it's not that they didn't do the carpal tunnel correct. It wasn't a carpal tunnel problem in the first place. The palmaris longus, if it goes into spasm, has a tendon that goes right across the median nerve, and if that goes into spasm, it's going to put pressure on it. And it's going to, even on nerve conduction study tests, will show a positive. So, they feel like that they know what it is, what to do, and then when the surgery is performed, it doesn't work, but it wasn't a problem with that in itself. It was a palmaris longus syndrome.
So what do you do for the wrist and the fingers? Do you just...
Absolutely, and that's one of the other nice things is you have the 8 bones in the wrist,
There's 8 bones in that wrist, wow.
In that little, wrist. And if those go out of place, you're going to have some difficulties. And so we adjust those on a regular basis. And you usually, you don't need to have carpal tunnel syndrome if you have someone who can actually rearrange the bones in the wrist, and we do that regularly.
You're a rearranger?
I rearrange those bones. It's a specialty type of adjustment, but it works great. People are always shocked at how well that works. And then you go in there, strengthen up the wrist, and
we have some fun things for that, like a bucket full of rice.
Yeah, and again, we look at a holistic type of a program. We try to combine all the different aspects that are necessary to get something fixed.
Okay, when we come back, we got a lot of more extremities to talk about, and even ribs. Ribs can get misaligned.
Absolutely.
All right. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, what can a new patient expect when they come into your office?
The first thing is that's extremely important is the consultation. That's really where everything begins.
And that consultation is complimentary free. They can come in, and the consultation's with you, which is nice. Yeah,
the consultation is absolutely critical. Matter of fact, you can get 90% of your diagnosis just from the consultation.
Listening to the patient.
Listening to the patient, finding out what their concerns are, what needs to be done, how we can best help them. Having a good understanding of the complaints of the patient is absolutely critical for good care, and the patient knowing that we are actually listening to them. We have very thorough intake forms that are extremely helpful. Gives us quite a bit of information of what's going on into the system. After the consultation, you have to look at the diagnostics.
Okay.
You
do an
first
examination.
have to understand, where the patient's coming from, have an idea, but then you have to know, what to do, what the problem is. There is a difference on our diagnostics than from the medical diagnostics. The medical profession, as a disease care-based program, they are looking at disease states and combinations along those lines to treat the symptoms. Our basis of our care is a understanding of what is the underlying cause, finding out what that is, usually caused by a break from homeostasis. And you're going to hear that word if you're listening to our radio program.
You're going to know
every
it well.
time. Because homeostasis is the basis of our practice, and homeostasis is the basis of health, and we are a health office. That is what a structure function office is. So the diagnostics are extremely thorough, probably more thorough than what you would get anywhere else. We look at very extensive blood work. We might do hair analysis, might do some evaluation of the gut because that's so important to one's health. We do a thorough cardiac evaluation. We do a thorough musculoskeletal exam. Many offices that even are into natural health are either just dealing with the functional aspect or they are just dealing with the structural aspect. We are unique in that we deal with both, and both of them extremely thoroughly and extremely well.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. You are more than just your spine. The extremities and adjusting the extremities. We have one last segment, and we have a lot of extremities to go over, but
We do.
let's go over the highlights. Let's talk about ribs aren't an extremity, correct? But they're attached to the spine.
Right. If you are doing a rib adjustment, then you have to put it down as an extremity adjustment, not a spine.
Okay.
So, what I'm, there's the definition, the official definition of the CPT codes. Ribs are included in the extremities.
Ribs are really interesting. If a rib's misaligned, you can have...
They can really hurt. I have some people who have come into my office who've had rib pain for years and years and years with no resolution. And we were able to get their adjustment done, and it's just like, oh, wow, this is what it feels like not to have a rib out of place. But the intercostal nerves in through there can really generate quite a bit of pain. So,
So how do you adjust the ribs?
Oh, it's actually pretty easy. You just take it, find out which direction it's gone, and then go the other direction.
Okay.
But
It sounds easy.
it's a matter of, the main thing on any type of adjustment is being able to palpate, tell the direction that it's gone in. There's always a right position for every bone in the body. And if you can determine which direction it's gone, if you go in the other direction, it is magical.
Right.
That's why people...
your training. Plus, you did some training on just touch.
Oh, yes.
Yeah.
Joe Maynard taught me the palpation portion, and he was amazing, what he could pick up with his fingers. So he actually started me out...
people will say, how does doctor know that? How did...
He started me out with a hair in the phone book. And I had to feel that, and he would place a hair in the phone book, and I had to tell him where it was.
Wow.
And when he could put it in the middle of the Atlanta phone book, and I could feel it on both sides, then I passed.
Wow. How long did it take you to do that?
That takes about 2 years.
Wow. So that was training on touch, because you can go right to the area of pain.
Right.
I think.
Right. Go right to the area of pain, feel exactly what's going on, feel the tension in the muscles, the positioning of the skeletal structure.
Yeah.
And then go in the opposite direction in a very gentle type of way. That's what people are amazed with. It doesn't hurt. When people think about moving bones, it's like, ooh, if they're not used to it. Then I do it, it's like, oh my gosh, I was worried about that. But we always adjust within the range of motion. And
you have a drop table that moves with
that helps out, takes some of the pressure off. I can do it without. But it's just a gentler on the patient to do it with a drop table.
Yeah. And gentle is the word I hear.
Gentle. And people sit there and go, oh my gosh, that's a miracle.
Until you get to eustachian tubes. Let's talk about that. That's the only one that...
Everybody kind of goes, ooh.
But glad to get the eustachian tubes opened up.
People come in.
Yeah.
I had one gal who stopped in. She had moved to Tennessee, was driving through. And she stopped in. She says, nothing's wrong but my eustachian tubes. I can't get anybody to do that one.
Because I've entered Indiana and with all the allergies.
Right. Can you open up my eustachian tubes? But that is an important adjustment.
We'll talk about that. Because it is.
The eustachian
like yesterday,
tubes.
I was working on someone after you opened up their eustachian tubes, and boy, was she draining.
Oh,
you
yeah.
know?
Yeah.
Drains.
It's very important for the upper respiratory infections, for tinnitus. There's a tremendous amount involved in that. And even sometimes, because it backs up the whole lymphatic tissue, people, have neck pain, and it's I get rid of it through the eustachian. It's lymphatic.
Yeah. So, in general, just so our listeners can have a visual, you tug at the ear.
Right. Basically, and there were, one of the ways I was taught is they actually went up into the throat, used the little finger, and then opened it up and that really, really hurts.
Yeah.
So this
You don't do that.
No, this is one where we grab a hold of the lobe of the ear, we pull out, and then a quick down, and that eustachian tube will actually pop. And it'll open up all the way down to the throat, and all of a sudden people are swallowing.
Yeah.
Because the mucus is running out
Released.
of there. Released.
Keeps people from getting sick.
Oh, it's very important for that.
Interesting. Okay, let's kind of go down.
Okay.
The hip joint.
Hips.
What do you do for the hip?
Hips, putting those back into place, very critical. We've got several people who, were scheduled for hip surgery, and were able to, prolong it. Some people who couldn't get hip surgery because they're on blood thinners, things like that, who we adjust and get some great relief. If we can keep up with that before the hip is degenerated, we can keep people from getting problems. But usually there's a misalignment in there before the hip starts to degenerate.
And when there's a misalignment, there can just be a lot of wear and tear on that
That's
joint.
very, very painful because you actually have it radiating down the side. The IT band goes into spasm when the hip's out of place,
Yeah.
and which will usually throw out the knee.
Yeah.
So getting that aligned up, and even then when people have hip replacements, sometimes those can go out of place and cause, I had one person sit there and say, the hip surgery was great. I had a couple of years, I had a little fall. Now it's hurting. I went back to the surgeon. He said, it's fine, but it hurts now, just like it did before the surgery. So I went in there, did the adjustment on it, and they got up and it's like, oh, it doesn't hurt anymore.
Yeah. It's amazing because the IT band can be so difficult. That's the band that runs from the hip to the knee.
And if you don't get the hip joint fixed, that IT band's never going to release.
Yeah. Interesting. How about the knees?
Oh, knees. You have two basic ways that the knee usually goes, either varus or valgus, whether the knee goes, comes in or goes out. And then that can really start to cause a lot of problems with the ligaments with the meniscus. You can actually go posterior anterior, which causes cruciate problems in through there. So finding out the alignment, and as I pointed out to people and show them, somebody's looking at somebody else's knee, can you see the misalignment there? And they go, oh yeah, I never noticed it before. And I sit there, go over there, do the adjustment. I sit there, and then I say to the patient, is the pain gone? Yeah, it's completely gone. I said, now look at the alignment. The other person goes, wow, I can actually see the difference. It's a very, very visible difference, very measurable, on the alignment, and it makes all the difference.
You align the kneecap also.
The kneecap gets out of, the kneecap can actually start getting out of its normal track, and that will cause a lot of spasms up through the thigh. So getting that lined up is a very important aspect. And then, of course, getting it strengthened afterwards. Again, I can't emphasize rehab enough.
How about the foot and ankle?
That is a very complicated. There's 26 bones in the feet.
26 bones.
26 bones, 56 articulations. So you can have a tremendous amount of thing going on in through the
We have
foot.
a patient coming right now that doesn't have any cartilage between those bones. I know you're treating her.
Exactly. And that they've even been told that there wasn't anything that could be done. They've even gone through surgery. So even post-surgically, we can get the changes in there to get the pain down. And that's one of the things as people talk about, I get a lot of referrals for the feet. Just because it's such a frustration for people.
Yeah. If
And
you're having a
there's-
hard time walking, you know it. I mean,
Right.
if you ever,
How are you going to keep off your feet? It's difficult. And there's a constant wear on there, and if the feet are off, everything else all the way up is going to misalign too. So making sure that the feet are aligned makes all the difference. And then of course, we also use orthotics. To
custom
keep it that way.
orthotics.
That helps to go ahead and shift the feet even further. Rehab, the exercises are absolutely.
I make people pick up marbles with their toes.
Oh, that sounds like fun.
Yeah.
Actually, it does. So all those different types of things, and making sure that that's all done. But the feet, we had a whole segment on that. Everything that goes on with
A
it.
whole show.
Whole show. Yeah. and getting those lined up it's a lot of fun. I enjoy adjusting them.
The feet. Well, we have about 30 seconds left. Dr. Prather, anything that you want to focus on?
Another big adjustment we do is the ileocecal valve.
Oh, yeah.
Where the large and small intestine join together, that can get inflamed, suck open, cause a lot of abdominal pains. Hiatal hernias are a very important part where we'll do an adjustment on the stomach itself and bring it down in position. We do that. Diaphragmatic adjustments.
Yeah, it's
very,
a muscle.
very important. It's a muscle in through there. Goes into spasm and can cause a lot of problems.
Okay. Well, thank you, Dr. Prather. You are more than just your spine.
Thank you.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.